Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not a either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates, so it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae. It is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age, na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really, like Simply Nature, that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
Hello po, ako nga po pala si Ronaldin Rosales Batalier, 23 years old at ako po ay taga Bicol, Albay. Na-diagnose po ako nung taong 2015, which is ito po yung mixed germ cell tumor sa ovary. Stage 1 po ako nung diagnose ako. Tinanggal po agad yung right ovary ko noon. May nakakita sa akin na taga doon sa amin, sabi niya, what if try ko daw sumali ng contest? Tapos hindi ko nga sinabi na may sakit ako. Sabi ko, sige baka sakaling kahit paano may pandagdag kami sa gastos namin. Then noong 2017 po, yun na po, pabalik-balik yung lagnat ko. Siguro mga 2 weeks hindi ako nawawalan ng lagnat. Tapos yun na, pagpa-check up ko kasi lumaki po yung tiyan ko. Doon ko po nalaman na yung cancer ko daw, numerous to count na siya. Yung sakit sobra pa, yung nararamdaman ko likod and sa stomach ko. Ganun po lumaki po yung tiyan ko, hirap na hirap pa ako. Nagawa po yung nakalatan na din yung lungs ko. Yung sa liver ko, kaya daw po lumaki yung tiyan ko, gawa ng sa liver po. Hindi na masyado nagpa-function yung mga organ ko sa loob ng tiyan. Yun po, ni-repair na po kami sa child house. And then, nung start na nag-chemo ako, doon na po kami tumira. Nag-stay na po sa child house. Akala ko okay na, wala na mangyayaring operasyon ulit. Pero nagulat po ako kasi every monthly check-up na lang po ako. Umuwi lang po ako sa amin tapos nagsusuka na naman ako. Akala ko kung ano na naman po yun. Yung dumi, nailalabas ko sa bibig na. Sabi ko, ano na naman to pa? Kaya na naman tayo, sisimula na naman tayo. May nakita daw po ulit na bukol sa diaphragm. Iyak na naman po ako. Sabi ko, hindi pa nga magaling yung sa ibang organ ko. Tapos ito na naman.
Hindi pa po as of now, wala na po akong treatment and may tumor pa po ako sa diaphragm and lately, may nakita na naman daw po sa akin ng gallstone sa may gallbladder. Pero napansin ko po talaga, start po uminom ako nung Simply Nature which is yung powder and tablet po na PPARs. Para pong pag nainom ko na po siya before ako matulog, pag nakakainom po ako, parang nare-relieve, parang nare-relax po yung katawan ko. Kaya siguro mga 2 days after na take ko po yung gamot, parang napansin ko na parang everyday na ako nagbabawas. Kasi po talaga dati, siguro sa isang linggo, 3 beses lang po ako nagbabawas. And nakita ko po talaga yung good feedback agad ng gamot na ininom ko. Kasi yun nga po, parang pag nainom ko po siya, parang yung sa loob ko na may something ako naririnig na tumutunog. And after yun po, nagbabawas na po ako. And parang ang gaan po sa pakiramdam. And parang medyo po nabawasan yung bloated ko sa tiyan. Start po nung uminom po ako. About po dito sa PPARs powder po, tinitake ko po siya every after meal. And based sa protocol po na ibigay po sa akin ni Doc Jansen, pag morning, which is 5 scoop, nilalagay po sa ilalim ng dila. And antayin mo po yun matunaw. Pag gabi naman po, tinitake ko siya after dinner, which is 4 scoop naman po siya. Kasi sa protocol po is kailangan everyday makatake ako ng 9 scoop. So, kapag po, based po sa observation ko, kapag po naiinom ko po itong PPARs powder, Parang yung something na tumutunog po talaga sa tiyan ko na parang may something, parang kiniklense na yung sa loob ng tiyan ko. And after po nun, magbabawas na ako. So parang after ko pong magbawas nun, parang feeling ko sobrang gaan ng pakaramdam ko sa tiyan ko. Tungkol naman po sa PPARS Plus tablets naman po, based sa protocol po na binigay po sa akin ni Doc Jansen, ano po siya, kailangan everyday makatake po ako ng 30 tablets. So sa protocol po na sinusunod ko, iinumin ko po siya with empty yung stomach ko. Pag morning, pagkagising ko, ito po talaga agad yung iniinom ko. 15 tablets sa morning, and after naman po, same, kailangan empty din yung stomach mo. 15 sa morning, ng pagkagising ko, and 15 sa evening after dinner ko before ako mag-sleep. Kasi yun nga po, mas pinipili ko siya after dinner na lang po siya inumin para po agad. Pag nainom ko po siya, yun nga po, nare-relieve yung katawan ko. Parang mabilis po ako nakakatulog, and naiiwasan ko po yung insomnia na lagi ko pong nararanasan noon po, lalong-lalo na po nung after po ako mag-chemo. So yun. Daily routine ko, yun, gumigising ako ng umaga for exercise kasi yun din yung advice sa akin ng doktor ko. Kailangan may regular exercise ako and pagkain ng mga masustansya pagkain. And yun nga po, nabanggit ko last time na mahilig talaga ako magluto. Yun po talaga, kapag kumakain po kami sa office, talagang ako po yung luluto po para sa pagkain po namin ng ibang mga kasamahan ko pasyente. As of now, thankful po ako kasi isa po ako sa nakatanggap ng scholarship sa isang magandang universidad dito sa Manila. Isa po sa nag-udyok sa akin para kumuha ako ng kursong education is yung mga bata po na kasamahan ko dito. So, nakikita ko po yung hirap ng papa ko. So, sinasabi ko sa sarili ko na hindi ako kailangan panghinaan ng loob. Kasi yung papa ko, nilalaban niya ako eh. Pero ako that time po kasi kapag naiisip ko yung tanim ko, parang ang sakit po. Like, nakikita ko yung papa ko na lumalaban. Pero yung katawan ko, pakiramdam ko po kasi sumusuko na kahit yung utak ko, yung puso ko gusto ko lumaban. Hindi matutumbasan ng pasasalamat yung nagawa sa akin ng papa ko kasi talaga sobrang bait ng papa ko.
And nung November po is nag-CT scan po ako. Doon ko po nalaman na may nakita daw po na bagong tumor po sa akin. So that time syempre naisip ko na okay na ako tapos may nakita na naman po ulit na bago. So I am so thankful po kasi nung December po is nakilala ko po kayo. Nakilala ko po sila Mr. Shyan, sila Doc Jansen po at ang Simply Nature staff po na alam ko pong nakatulong po talaga sa akin. And yun nga po, nung nakita po na parang bad yung result ng CT scan ko, and after po ng December, bali po after December po, and until June, July, bali nakatatlong CT scan po ako. At nakita ko po talaga yung improvement po ng result ng CT scan and ultrasound ko po. And I'm so happy po na nitong latest na CT scan ko nung July, tuwang-tuwa po si Doc Jansen kasi talagang nakita po niya na lumiit po talaga yung tumor ko. And masayang-masaya po ako doon. Siguro kung wala yung Simply Nature, siguro yung tumor na nakita po sa akin, I think siguro po mas lalala po siya. Kasi yun nga po ang sabi nila, kapag na-stress yung pasyente, mas lalo po yung nagtitrigger yung cancer po. Kaya yun nga po, maraming salamat po talaga sa Simple Nature kasi kung hindi po dahil sa inyo, siguro hanggang ngayon stop pa rin po ako sa pag-aaral. Ngayon po, gusto ko lamang po pala ipaabot ang aking pasasalamat kila Doc Jansen and Mr. Shyan. Maraming salamat po talaga kasi alam ko po talaga nakatulong po siya sa akin at alam ko pong mas lumakas po ako. And sabi nga po ni Doc Jansen na kahit slowly siya, sure naman po talaga na gagaling po ako. Kaya maraming salamat po sa walang sawang pag-support po sa akin.
episode of Simply Nature webinar, your long-time running healthcare awareness webinar here on social media. This program is powered by Simply Nature International and SMG Simply Healed Medical Group. Tonight's topic is entitled Overall Solution for Prostate Cancer and Diabetes. In the next few minutes, we will delve into a critical intersection of medical care and overall solution for the coexistence of two prevalent health challenges, prostate cancer and diabetes. Prostate cancer and diabetes are two distinct conditions, each with its unique set of concerns, but their coexistence is not uncommon, presenting a complex of multi-phase healthcare challenges. We appreciate each and every one of you for watching and registering for this webinar. Also for sharing this online event with your friends and loved ones who are also undergoing this kind of illness. And now, without further ado, to start off this discussion for tonight's topic, I'd like to call on a successful entrepreneur and international speaker on a wide range topics from personal success, to healthcare, the CEO and founding director of Simply Nature International, our PPARS expert from Singapore. You all know him, right? No other than Mr. Shyan Lim.
Hi, April. Thank you
Hello,
for
Sir
watching,
Shyan.
everybody. So, April, today is your turn.
Yes, sir.
So it's usually Sheila and Jen, and now we also have April. So tonight's topic is something that is relevant to almost everybody because there is a component of diabetes. And of course, prostate cancer is one of the slow-growing cancer, but it's one that every male should be very concerned about. So enjoy today's discussion because I believe Dr. Jansen is going to do a live case study of his patients. So without further ado, remember, there is an Ask Me Anything segment directly after the discussion. So prepare your questions. We'll answer all your questions tonight. And without further ado, I'll hand the time back to April to introduce Dr. Jansen.
Yes, sir. Thank you, Sir Shyan. Our next speaker is a graduate from St. Luke's Medical Center College of Medicine in 2016. In 2019, he was conferred as a diplomate of the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. He is also the president of Simply Healed Medical Group and consultant at Alta Integrative Medicine and Wellness Complex at Perpetual Health Medical Center Las Piñas, where he manages patients with cancer and metabolic illnesses. Let's welcome Dr. Jansen Kalalan.
Hello, April. Good evening. Thank you for the nice introduction.
Thank you, Doc. Thank you,
Okay,
Dr.
so
Jansen.
let us start our case presentation for tonight. No, so the topic for tonight is I think everybody would find it quite interesting and quite encouraging. Okay, because this patient is a prostate cancer patient of mine who have improved his condition through natural means alone. Okay, so without further ado, let me just share a portion of my screen, no, so we can begin the discussion for a while. For a while. Let me just fix this. Okay. All right. I hope you can see my screen now. Okay, is it good? Okay, so let's begin. So this patient of mine is a 73-year-old male who was diagnosed with prostate cancer. Okay, the symptoms started as a urinary frequency, which began early this year, February 2023. When he got his PSA check, it was at 6.29. So because of this, this warranted a prostate MRI. And with the prostate MRI, there were 4 lesions that they discovered. And each of the 4 lesions was assigned with a PIRADS category of 3. Now, what is PIRADS category? Now, this PIRADS category is very similar to your breast cancer mammography category, which is BIRADS, no? BIRADS, B is for breast, but here it's PIRADS, no? Which is P stands for prostate. Now, this is a um, criteria to gauge whether or not the lesions that was found in the imaging studies are more probably benign or more probably malignant. Okay, so basically this is just a criteria to know the probability, more or less, no, if the lesions that the radiologist found leans more on the benign side or leans more on the malignant side. Okay, now PIRADS category 3 is categorized as intermediate. Now, intermediate means that the presence of clinically significant cancer is equivocal. This means that the lesions that they found, it's either benign or malignant, 50-50. Okay, so they don't really know if it's malignant or not. Okay, so that's what it means basically. Okay, now of course, since the patient's PSA is high, it's more than 4, right? It's at 6, and you have 4 lesions here that they are not sure whether it's benign or malignant. Of course, you would want to know whether or not this is really cancer. So the next step for this would be to get a biopsy. And lo and behold, no, the lesions that they got were actually cancer, prostate adenocarcinoma. However, the Gleason score is 6. A Gleason score of 6 is actually low-grade prostate cancer. For low-grade prostate cancer, these are the 4 treatment options that the urologist proposed to the patient. Number 1 is active surveillance. So this is just observation. Number 2 is surgery, remove the prostate. Number 3 is radiation therapy. Actually, 3 and 4 are both radiation therapy. It's just external beam or brachytherapy. Okay. Now, the patient opted for active surveillance. So just observation. Okay. And while he is on active surveillance, he also implemented the necessary lifestyle changes, okay, such as a plant-based diet and an hour of walking every single day. Okay. Now, upon implementing these lifestyle changes, his PSA went down to 1.8 after 4 months. And this is basically reversal of the disease, no? So from 6 down to 1.8 without any medications for the prostate. However, during this time, the patient still feels urinary urgency, urinary frequency. Okay, there was no improvement at all at this point. And just to give you an idea of the medications that he was taking at this point, it was these medications. So you have your tamsulosin. Tamsulosin is basically for the urinary frequency. So that's to make the urinary symptoms less severe. Okay. Clopidogrel is a blood thinner. Carvedilol is an antihypertensive medication, mainly acts on the heart. Lisinopril is also a medication for hypertension. Atorvastatin is a medication for cholesterol. Febuxostat is for uric acid. Then the others are just supplements. Okay. Now, here are his other laboratory tests. No. So over here, you can see that his cholesterol is at 167, which is basically normal, as you can see here, no? Normal cholesterol level, triglycerides, uric acid levels because of the medication. So at this point, I assessed him to have prostate cancer stage 1 with prostate enlargement as well, type 2 diabetes, and with a controlled hypertension. Now, for his management, my goal is to try to dissolve or basically try to dissolve his prostate cancer, no? And of course, also to reverse the diabetes. So this is why I prescribed him with PPARS powder and Neurogen E, of course, for his vitamin B complex for the diabetes as well to prevent peripheral neuropathy and to check again his laboratory tests after 3 months. Okay. However, the problem is because of financial constraints, the patient was not able to go for PPARS powder. Instead, he went for PPARS tablets. Okay, so it's just for overall health. And with PPAR's tablets, uh, he would still benefit from it for his diabetes. Okay, and of course, still maintain exercise. So on follow-up on October 2023, he reported dizziness and lightheadedness during this time, and his blood pressure, upon checking, it was at 114 over 57, which is quite low, which I think might be because of his antihypertensive medication. So I actually told him to go back to his cardiologist, and his cardiologist reduced his carvedilol medication. No, also lisinopril, the other antihypertensive medication, was stopped altogether. Right now, he also noted an improvement with regards to his blood sugar control. So it is now at 140 mg per dl. Okay, for the fasting blood sugar. Likewise, his lipid profile, the total cholesterol level from 167, it came down to 119. For his for his uric acid level as well. Okay, so these were the improvements. Okay, and of course, he again had another repeat MRI, which showed no significant change in the prostate lesions, although lesions 1 to 3 had a reduction in size. So it's still the same, still at PIRADS category 3. However, his prostate size increased. So what does this mean? Now, remember, the prostate is an organ. So inside his organ, there were 4 lesions that was discovered, which has prostate cancer. So the other tissue surrounding those prostate cancer locuses or locations or areas, you still have normal prostate tissue. Now, I am thinking of 2 possibilities in this regard. So number 1 is a benign prostatic hyperplasia or benign prostatic enlargement because of age and because of the diabetes, no? Possibly because of the diabetes as well, which is unrelated, not related to the prostate cancer itself. Okay? Another one is prostatitis, which the MRI actually indicated, no, that there might be an underlying inflammation of the prostate, which was the reason of the enlargement of the prostate gland. Okay? Now, between these 2 possibilities, I am leaning more on of a benign prostatic enlargement on top of the prostate cancer versus a prostatitis because of an infection. Why? Because the symptom of the patient is only urinary urgency. There was no pain at all. There's no burning sensation when he urinates. There's no fever as well. When I look at the urinalysis, it was normal. Okay? So, at this point, here is what I was thinking already, no? So, the type 2 diabetes is improving. The dyslipidemia is also improving. The high uric acid is likewise improving. And of course, the prostate enlargement. So, with this, I now decided on these recommendations, no? So, febuxostat, remember, is a medication for uric acid. So from a once a day dosing, 40 milligrams once a day dosing, I reduced it to 20 milligrams once a day. So it's just half a tablet now. For the atorvastatin, I decided to give atorvastatin once every other day, but still at 10 milligrams. Okay. For the Neurogen E, of course, we have to continue that. It's a vitamin B complex. Now, anyone who is on a plant-based diet should be taking a vitamin B complex supplement with vitamin B12. Okay, and of course, Duodart. Now, Duodart is a medication for prostate enlargement. Okay, it's a combination medication with tamsulosin and dutasteride. Tamsulosin, again, is for the urinary symptoms so that the patient can urinate properly. Dutasteride is an anti-testosterone medication. It mainly acts on the testosterone to prevent enlargement of the prostate. Okay? And of course, to repeat laboratories after 3 months and after 6 months. Also, I recommended Ibu, which is ozone therapy, and immune dip for his prostate, which is alternating every 2 weeks for 1 year. Okay. The reason why I recommended these two modalities is because number one, the prostate is an organ that is not highly vascular, so meaning its blood supply is not that good. So I wanted to increase or enhance his blood flow, okay, in all of his body, so that the penetration of the nutrients, the PPARs, and these medications would be better inside the prostate gland. Of course, number two is the immune drip. Basically, this is to strengthen his immune system. And upon follow-up, lo and behold, I just discovered that the patient had peripheral artery disease. So peripheral artery disease is basically an artery in his extremities, no, that got clogged with excessive cholesterol. So ozone therapy is also very good for peripheral artery disease because it can reduce pain in his lower extremities when he is walking. Okay. So of course, the other one would be, I cannot still rule out the possibility of a bacterial infection that led to prostatitis. So I told him to follow up again once he is already on Duodart for at least 2 weeks, 1 or 2 weeks, just to know if he had improvement in his urinary symptoms. Now, if he still has urinary symptoms during this time, even after giving Duodart, then I might consider giving him antibiotics already. So that's it, everyone. Thank you for listening. We can now answer whatever questions you may have. Thank you.
There we have it. Thank you so much, Doc Jansen, for Thank you so much, Doc Jansen, for that informative and encouraging presentation. So, for those of you who are diagnosed or have experienced this kind of illness, please stay strong, don't lose hope. Illness is manageable with a right and proper management, especially when discovered in early stages. Also, diet and lifestyle are very important contributing factor as well. Let me also do a shout out first. Thank you to our regular viewers. You guys are the pillars of this event. Thanks for tuning in and keeping up with us. Your support means the world to us. From Malaysia, Miss Lily Lu, Susan Patane, Josephine Chua. Webinar is not the same without you. And we are now in what we call AMA portion. At this point, questions are very much welcome. November is a diabetic awareness month. That's why if you have questions, just type and list them down in the comment section below. So I'd like to call on to answer our questions for tonight. I'd like to call on Dr. Jansen Kalalat. And of course, let's call on once again the CEO of Simply Nature International, Mr. Shyan Lim. By the way, I would also like to greet our new viewers from Legazpi, Albay. How are you doing, Ma'am Josephine? So, once again, Dr. Jansen, how are you doing right now? Your presentation is quite informative.
Yeah, thank you. No, I hope our audience learned a lot with a simple case presentation. No, and I hope they were encouraged with the result of the patient, even though the patient is actually more leaning on a natural treatment. No, and of course quite financially constrained as well. Okay, so with this, I hope everybody is inspired that even if they are financially constrained, um, they still have hope in getting well as long as they're disciplined.
Yes, thank you, Doc. Hi, Sir Shan. So
Yeah,
let's
Doc,
start.
it's so nice that this patient actually used a totally natural method of getting his cancer under control. And to our audience, you guys have always been asking Doc Jansen, is there another way? And we can't choose a better type of cancer. Prostate cancer is a slow cancer, so you have time, so time's on your side. So choosing natural is a great way. So if you want to find out whether your cancer can be treated naturally, go and make an appointment with Dr. Jansen, or you can ask the questions right now. So April, please.
Yes, let's start the first question, Sir Shan and Doc Jansen. So it's coming from Robert Julius Muyot. Can PPARs help to drain naturally the septated pleural effusion with lungs, right upper lobe? Thank you. From Robert.
Okay. For everybody's information, no, a septated pleural effusion, what does this mean? Okay, you have your lungs, right? You have your lungs. Septated means there's a portion of the lungs that was closed off. Okay, it was closed off. Now, inside that closed off area is a fluid. That's why it is pleural effusion. So basically, what the body did, no, was to lock up or close off the area of the lung that was filled with fluid. Now, the only way for you to drain the fluid inside there is to aspirate it. Okay. Also, of course, no, you have to also know the root cause why it happened in the first place, because infections can produce that effect, cancers can produce that effect. Okay, so you have to find out the root cause and treat the root cause, because acceptated pleural effusion is a complication already. Okay, now the question is, can PPARs reduce the pleural effusion? The answer is yes and no. Okay, yes it can, because PPARs can treat the root cause. So you have to know what the root cause is in the first place. But in and of itself, no, to drain the fluid immediately, then you have to aspirate it. So the question is, would PPARs immediately drain or reduce the fluid inside that area? No. Okay, you have to aspirate it as soon as you can, because if there is a septated pleural effusion present in the lungs of the patient would have difficulty breathing, and it can also worsen. It can enlarge. No, if it enlarges, then that can produce pressure to the lungs. The patient will have difficulty breathing. So at this point, this case is actually urgent. So I advise you to drain it immediately, not wait on whatever for its effect to occur, because it might not happen. Okay, if you wait for a treatment, so immediately you have to aspirate this. Immediately remove the fluid.
Yeah, thanks, Doc. That's very important. That's why it's so important to know what can be treated naturally and what has to be fixed mechanically. And aspirating it out is actually a very direct way of draining the fluids in your lungs. April, next question.
Okay, thank you, Sir Shan and Doc Jansen. For our next question would be from Maria Shello. I have a cervical cancer, stage 3C, metastasized in abdomen. Done treatments last year and another 6 cycle of chemo this year. PET and CT scan result that my tumor still there but didn't grow much. And they saw something in my liver. Doctor suggested that I do another therapies, which I declined. I wanted to see a naturopath doctor to help me. Please, I need guidance and help treatments last year.
Okay. I am not a naturopathic doctor, okay? But this is my advice for you. Knowing your case, no, this is what I will do. Though I still have to talk to you, no, have a formal consultation. But the treatment on top of my head, no, that might be able to help you would be ozone therapy, mega dose vitamin C, and PPARs. Okay. Now, what would be the role of these three modalities? Number one, the PPARs would make sure that your immune system is functioning well so that it can fight off the cancer. Number two, study have shown that PPARs stimulates apoptosis or cell death. Okay, so these, knowing this, no, that PPARs can have this effect, we might have a good chance of or of shrinking the tumor. So another one would be ozone therapy. The main function of ozone therapy in this regard is to, okay, before we go to ozone therapy, erase. Before we go there, let me discuss megadose vitamin C first. What would be the role of megadose vitamin C? Megadose vitamin C's role would be to also destroy the tumor. How? Megadose vitamin C would be given intravenous. Okay, how high is megadose? I am The standard dosing for this is between 15 grams to 50 grams. Okay, but my goal there is to give you 50 grams since the tumor is quite widespread already, but I still have to see the PET scan. Okay, so megadose IV vitamin C at 50 grams. Okay, then lastly is ozone therapy. So what is the function of ozone therapy for this? It's mainly to enhance blood flow, improve your blood flow so that the megadose vitamin C would be able to penetrate the tumor deeply. Okay, to reach the far flung areas of the body. I think the deepest part of the body. Okay, so that would be the main role. Now the next question is how frequent should we give it to you? That is why I need to see you and talk to you to determine the frequency of the treatment. Okay. There are also other treatments that I know of that might be able to help you, but at this point it would be better to schedule a consultation, no? So I can make the proper recommendations, the dosing, what type of PPARs would we be using as well. Okay, so that's my general advice.
Yeah, and I would like
Session.
to advise the viewer that I think for cancer, it's always great, right? If you are going to a naturopath, I would still suggest that you see a MD, all right, even if it's just your family medicine doctor, because I think cancer is something that you have to always keep under good monitoring, because for everyone's understanding, most naturopaths are not medical doctor trained. All right, so certain aspects like physiology and anatomy, they may not be equally trained. So there's no standardization of how well trained or how deep a naturopath is. So some naturopaths are very experienced, some are not so. All right, so Dr. Jansen is full MD, very well versed in chemotherapy and all these protocols. So he's aware. And yet, Doc, thank you very much, because you actually provided, as a doctor that's so familiar with chemotherapy, radiation therapy, and with friends like Dr. Jamie Cantapia, which is one of the top surgeons in Philippines. You have all the knowledge, and yet you are also able to give a totally natural approach to treating cancer. So for everyone, I would suggest, even if you're going to see a naturopath, which is definitely something you can explore, do have a medical doctor like Dr. Jansen still overlooking your case, right? Because you want to know whether there is ever a need for medical intervention. Yeah. Right, Doc?
Okay. Oh, by the
Yes.
way, so for those of you who wish to have a consult with Doc Jansen Kalalan, the link to schedule an appointment is in this description box, or just type in on how to consult in the comment section below. Our pretty healthcare specialist, Beth, will reach out to you shortly. Okay, so for the next question, this will be coming from Miss Josephine Chua. Is there any government-accredited health facility in the Philippines that offers immunotherapy? And the second question would be, what are the other ingredients of PPARS tablets other than microalgae or chlorella and grape extract? So I think
I
Sir
will
Shyan would be the
answer the
best.
second
Yes.
question. Doc, you want to take the first one on immunotherapy first?
Yeah, I'm actually, this is a very good question. I'm actually thinking if there is one. Uh, I'm actually not quite sure, but your best bet would be PGH. Yeah. Why? Because immunotherapy is a relatively novel treatment for cancer. Although there are a lot of immunotherapy medications that has approval from FDA already to be used as a treatment for specific types of cancer, no? However, I am still not quite sure if PhilHealth covers it. Yeah, that's the problem. And if you do have a government facility that administers immunotherapy, I am not sure if it is 100% covered, meaning you won't pay a single cent. Okay? Or if you will do pay something, it would be relatively cheaper. Okay? How cheap? I do not know. Okay? That one I don't know. I don't really know if how cheap it would be. All right? But I hope that now if there is someone watching us now from the government who is or who knows someone there in the government, especially in the DOH, this is something that is really very important for Filipinos because immunotherapy is really effective. Okay. However, the problem there is it is too expensive because one dose of one type of a very common immunotherapy, like pembrolizumab or Keytruda, one dose costs 200,000 pesos. And this medication has to be given once a month, usually for life, or until the patient develops complications or total resolution of the cancer. So this is how expensive it is.
Wow,
So
Doc,
the
that's 2.4 million a year
yes.
for
So
as long as you can tell. Yeah.
yes,
Wow.
correct. Now obviously not everybody would be able to afford this kind of treatment, no? Now this is why it's important for the government to really push the prices down, really to pressure the manufacturers to make it cheaper. Okay, so that's for the first question. Okay,
Yeah, I will
so
handle the second
yeah,
part.
yeah. So again,
Okay.
your
So
best bet would be UPPGH. Okay.
yeah, right. And I think in Philippines, I know of many cancer patients that have many grants, even if it's not covered by medical health. There are like grants like the Philippine sweepstakes. I know they support a lot of child house kids cancer patients who can't afford the chemotherapy. All right. So first, a big shout out to Salia Bonginvilla. I hope I didn't butcher the name. I'm so sorry. All right. But she said, I'm always on your program. So thank you. We are sending our heart to you also. Thank you for your support. Now, let me answer what's inside PPAR's tablets. All right. Okay. If you go to Simply Nature's Lazada Mall, you will see that we have two forms of tablets. All right. One is just PPAR's tablets. That is a mono ingredient product. It's totally plant-based, natural. All right. There is no other thing added to it and nothing taken away from it. All right. So the PPAR tablets is made from a unique strain of microalgae. Yes, as our viewer asked, does it contain chlorella and what's that? Grape skin extracts. What else is in it? Number one, it is from the family of chlorella, but it is not your usual chlorella. It is a unique strain, right? And this one, we actually have all the facts. In fact, in some countries where we distribute, some distribute like in Taiwan where this is made, some people claim that their product is the same as ours, and we actually went to court to actually look at it, and it is different. The main difference is that the normal strain of chlorella does not have PPAR agonist. And what you really want from the PPAR's tablets is the PPAR's agonist, right? So that's uniquely found in our strain of microalgae. And yes, our microalgae belongs to the general chlorella family, but ours is a special strain. Now, there's another type of tablet that we have, which is PIPA Plus tablets, all right? That is labeled with a blue color wording. What we added to that is grape skin polyphenols. Here in Philippines and in Asia, we're very famous for resveratrol. Now, that's what some supplements are. Resveratrol is beneficial for you. But like what we believe here on our program is not to take a single extract if you can avoid it. If you can take a more complete extract, that will be better. So ours is the red grape skin polyphenols. So it's a whole spectrum of polyphenols, which includes resveratrol as one of the polyphenols. So with the full spectrum of polyphenols, you will have a better health benefit. Now, why do we choose to add grape skin polyphenols to our PIPA tablets? Because the mechanism, the way they work is different, but they both work on a cellular level. So it's synergistical, and it's the best base supplement that you can take, especially if you're a cancer patient. So I hope I gave you a very clear understanding what a product is. I think the most important thing is there's nothing added to it. So no fillers, no binders, no preservatives, all right? Yeah.
Okay, thank you, Sir Shyan. Okay, so this next question will be related about prostate. So from Chris Jesmundo, Doc, ano po ang mabisang gamot for prostate?
Okay, the prostate is an organ. Okay, so what medication is good for the prostate? What is the prostate disease? I need to know the specific disease, no? Because you can have prostatitis, prostate cancer, benign prostatic hyperplasia. Yeah, okay. So I have to know for what condition. Okay, yeah.
But Doc, I think in general, right, people who develop prostate problems, fiber is one of the lack of fiber, one of the things that can lead to piles and prostate complications over a long period of time.
It's correlated, though it's not causative.
Okay.
So keyword here, no, correlation and causation. A low fiber diet will not necessarily lead to prostate enlargement, okay, just because of the low fiber diet, but a low fiber diet can lead to development of other diseases that can contribute to the enlargement of the prostate. So how does this happen? Okay, so prostate enlargement can be rooted because of inflammation, especially chronic low-grade inflammation. Now, a state of chronic low-grade inflammation can occur if you have a very low fiber diet, because essentially, if you have a low fiber diet, you won't be eating enough plant foods, no, fruits, vegetables, whole grains, and legumes, no, and we can source antioxidants from these plant foods. Now, if you lack these plant foods, then you won't have enough antioxidants circulating inside your body. So if you don't have enough antioxidants, then you might be in a state, no, or you might develop a state of chronic low-grade inflammation. And on top of that, you can develop other metabolic illnesses as well, which can also link or contribute to prostate enlargement. Okay, so this is how it is related. Okay.
Okay, thank you, Doc. And also for this next question from Norma Pasqua, can we drink milk if we have breast cancer, Doc?
Only drink plant-based milks, not dairy products or cow's milk or cheeses or what have you. No, always drink plant-based milk products like soy milk, almond milk, oat milks.
Thank you, Doc. So for the next question,
I think this is a very common question because many cancer patients also want to put on weight, especially if they get thin. So they always think milk makes you strong, right? But milk is a big no-no for cancer patients. So change to oat milk. Oat milk tastes great in coffee.
Okay, for the next question, also from Miss Gloria Armado. Hi, is osteoma cancerous?
Oh, okay. Osteoma. Okay. From the word itself, no, for everybody's information, osteo means bone. So osteoma is a benign mass found in the bone or on the bone. Okay. So this is not cancer because if it is cancer, then it would be named as osteosarcoma. Okay. Osteosarcoma is more commonly found in kids, no? Yeah, children and early teenage kids. Yeah. So osteoma is a benign lesion. It is not cancerous. Okay? Yeah.
Well, that's good news for our viewer. So you asked that question. I hope you found the peace that you wanted from that.
Nice. Okay, thank you. So, by the way, there's a follow-up question from Miss Josephine Chu, actually. Can PPARs be considered anti-angiogenic? If not, is there any among the supplements of the company? Thank you very much, Doc and Mr. Lim, for always providing straightforward answers.
I think the straightforward answer is yes. It's anti-angiogenic, right? Which is the formation of your blood vessels. Okay, so now, but it is not anti-formation of your blood vessels in an unhealthy way. Okay, so because our natural body needs the formation of blood vessels. Now, why is it so? It's because there is anti-inflammatory modulation. So by taking PPAR tablets, you lower your inflammation in the body. So inflammation, when it's lowered, it prevents unnatural or unnecessary formation of blood vessels. Now, for cancer, what's so important about the formation of blood vessels in a cancer patient? Your cancer tumor cannot grow beyond a certain size unless it forms blood vessels for most forms of cancer. Okay, so once it gets a certain size, it needs more nutrients to continue to grow and to stay at that size. So that's why it forms its own blood vessels to feed it. Now, if you manage inflammation, you make the condition more difficult. So in that case, in that sense, yes, it is, right? But yet, don't remember, your body still needs to maintain it and continue renew its own blood vessels, right? So you don't just want complete blood vessel formation. Yeah. Dr. Jansen, correct? Did I get that right?
Yes, yes. Okay, I won't give you the mechanism already, but yes, it is anti-angiogenic, okay, but not in the negative sense that you won't be able to form new blood vessels whenever you're, injured or something. Okay, definitely you would still form new blood vessels when it is necessary. What it prevents is the excessive formation of blood vessels, especially in conditions such as diabetes and cancer.
Thank you, Doc.
Okay, thank you for those answers, Doc and Sir Shyan. By the way, this next question coming from our YouTube telecast from Manison Payay. How often and on what age should be male patients have their prostates be checked?
Okay, we have two criteria here. Okay, so number one, do you have a family history of someone in your family who was diagnosed with prostate cancer, especially first degree family members, no, like your parent, your dad, your grandparents. Okay, now if you do, then you have to be tested at least 10 years early, no, when they were diagnosed. Okay? So say for example, they were diagnosed with prostate cancer at the age of 55, for example. Then you would have to get tested at 45 years old already. So which screening test should you undergo? That would be PSA. PSA would be taken from your blood, and of course, a prostate ultrasound. Okay, so those two are the primary screening modalities. Now, what if you do not have a family history of prostate cancer? Then it would have to be at 50 years old. Okay, so at 50 years of age, everybody, all males, no, regardless of history, you need to get checked for, you have to get screened for prostate cancer already. So that would be, again, the test that you would have to undergo would be PSA, that would be taken from your blood, and then your prostate ultrasound. Okay?
Notice there's a question in the Facebook chat, and I'm glad we answered YouTube questions. So more YouTube questions will be great. Right? Someone asked, Maverick Z asked, is it curable for a stage 4 cancer in senior citizens? The short answer to that is yes, it's always possible. All right. However, in senior citizens, you might want to check based on age, what you really want to achieve. Sometimes just palliative, that means making the patient comfortable and just extending their life might be the primary goal instead of trying to cure the cancer. For example, if a patient is already 85 years old, all right, just slowing the cancer down so that the patient can really enjoy him or herself, travel, or maybe be able to interact with the family members. That could be the most important goal rather than trying to cure the cancer. Because in trying to cure cancer, things like surgery, radiation therapy, chemotherapy might come up as options, right? So if those are probably very strong options in which to treat cancer. However, when a patient is much older, like 85 years old, 78 years old, the priorities might be different. But the short answer is yes. There's always been cases of cancer patients, stage 4 cancer patients, senior citizens getting well. So it varies from patient to patient, but definitely it is possible. Right, Doc? Doc, I remember your grandma is a good example.
Yeah, but my grandma, was she stage 4? I can't remember. Oh my gosh. I don't think so.
Yeah.
I don't think so. Yeah.
Okay, but she
But,
was a senior citizen, right?
Yes, she was. She was already in senior years when she was diagnosed
Quite
with
old, if I
breast
remember. You
cancer.
told me like 70 plus, right? If
Yeah,
I'm not.
yeah.
Yeah, so that's
70.
great.
Yes.
Yeah, that's really great that a 70 plus cancer patient actually got fully recovered. Yeah.
Okay, so again, thank you for the answer. So for those of you again who wish to have a consult with Dr. Jansen, there's a link to schedule an appointment. It is in the description box, or just type in how to consult in the comment section below, and our healthcare specialist Beth will reach you shortly. So Doc and Sir Shyan, let's have another question. So, there's a lot of questions coming in. So the next question would be from Miss Sally Esguera. Doc, I guess it's her tatay using, or there's a duodart for some years, prostate enlargement 34 grams, PSA 11. What would you advise?
Okay. 34 grams of prostate is huge, especially the PSA of 11. Now, one thing that I will think of is the patient might have prostate cancer. So at this point, I would have to check, no, whether or not there is a tumor actually present. So an MRI of the prostate, I would recommend that. And if there is a lesion, or if there is a mass inside the prostate, then of course prostate biopsy. Okay. But from here on out, no, immediately put him on a plant-based diet. Because if he is not on a plant-based diet, it will be very difficult for the body to reduce the PSA. Now, the prostate enlargement of 34 grams, my advice for you is to continue the duodart. Okay? But with the duodart, it should have reduced in size already. So I don't know what's the previous size of the prostate. It might have shrunk already. If it didn't shrink, then one reason that might be contributing, that's why the prostate doesn't seem to be responding, is his diet. Okay. So that would be my advice. But to really treat this, my advice to you is go for a consult. Schedule a consult so I can give you the more specific advice. Okay, but at this point, that is what you need to do. Okay, the things that I have mentioned.
No, Doc,
Okay.
thank you for the advice. And to all the viewers, one thing that you can do always immediately, like immediately after the program, is what you put in your mouth, right? So an immediate adjustment to your diet will put your body in a great condition. So even as you're scheduling a consult with Doc Jansen, if you already move the very next day, you stop eating meat, you're eating more vegetables, you start to feel cleaner, you start to feel better. You put yourself in a very great position such that no matter what protocol that Doc Jansen is going to set you on, you're going to be in a better state. So first thing I would advise is if you're drinking milk, stop that. Switch immediately to oat milk, right? Yeah. And drink more water, take more fruits and vegetables, and then you'll be in a great position to receive and benefit from whatever protocol Dr. Jansen will give you. April?
Okay. So, Sir Shyan, our next question coming from Miss Laurie. Is PPAR same with
Okay.
stem cell?
Oh no, totally different. Very good question. Okay. First of all, I think I would definitely would like to hear Dr. Jansen elaborate a little bit on it, but I'm just gonna give I mean on the cost part. Okay, I just want to highlight something. I think in the last 5 to 6 years, especially in the supplement industry, the word stem cell has been thrown around a lot. I've personally tried products like apple stem cells. Yes, you heard that right. Okay. I think to Dr. Jansen is like, what are you talking about, Shen? All right. What are apple stem cells? Okay. So they're actually plant-based stem cell products, right? That are on the market. So in general, there's a bit of a confusion about what is medically effective stem cell treatment and what you can get off the shelf in terms of supplement powders and things like that. We always hear things like that. This is a stem cell product, right? Okay, so all those, first off is stem cell products are not cheap. Okay, so it's really not something you can like buy a box of stem cells from Mercury Drugs or Guardian Pharmacy. No, they are not like that. The effective stem cells products are not like that. So I think Dr. Jansen can explain a little bit about what stem cell products, how stem cell products are actually, what are they? All right, they're not your powder that you can drink out of a sachet. Okay, number two. PPARs are not stem cells and they work very differently, all right? Stem cells are basically cells that are, if I'm not wrong, okay, they are basically omni cells, like they're cells that can become anything. I hope I didn't get it confused with, yeah, Dr. Jansen is nodding, yes. So does it help directly cancer? Yes and no. Okay, but PPARs doesn't work like that. PPARs is actually a gene activator. It activates your genes that control certain functions in your body, like your inflammation, like your metabolic processes, like the replication of your cells. So if you are actually taking real stem cell treatment, PPARs is a great combination with your stem cell treatment. All right, because PPARs will help that stem cells develop properly, to be it immune cells, to become blood cells, whatever. So PPARs will actually help that. So stem cells and PPARs are different, but if you're actually getting real stem cell treatment, PPARs will actually benefit your stem cell treatments. So Doc, maybe you can share with us, just in case, we think some of our viewers are being sold or someone's presenting to them, hey, this is a stem cell product. It's $30 US, you won't find stem cell products at $30 US. Yeah. No.
Okay. So Shen is correct, no? PPARs is very different. It's not a stem cell product, basically. So PPARs is, again, it's a microalgae. Okay, it's a microalgae supplement. Stem cells is different. So what are stem cells? So with the word of stem, no? So um, okay, we have different kinds of cells inside our body. So you have your skin cells, you have your teeth cells, you have your hair cells, you have your blood cells, whatever cell, okay, inside your body. Now, every single cell found inside your body came from a stem cell. So a stem cell is essentially a cell that can become anything. Okay? So this is very similar to your student. A student can, in the future, can become a doctor, can become a pilot, can become a soldier, a businessman, a lawyer, etc. Okay? So stem cells are basically students. All right? Students. Okay? So when you're out there in the market, how do you recognize that the product that is being sold to you, or the stem cell product that is being sold to you, is legit? Number one, it should not be administered orally. Because if stem cell, you eat it or you drink it, your digestive system will destroy it. Okay? So it's very similar to eating meat, right? Meat are basically muscle cells. So when you eat that, your stomach acid will destroy that. Similar to stem cells. No, it will destroy the stem cells. So legitimate stem cell products are either administered intravenous or direct. Okay? So say for example, what are some applications for stem cell therapy? Patients who have underwent multiple chemotherapy sessions and their bone marrow got destroyed already. So they would be a candidate for stem cell therapy. So that would be bone marrow stem cell therapy. But bone marrow stem cell therapy would have to be given together with bone marrow transplant. Because if the stem cells are administered to an area of the body that was destroyed already, it cannot survive. It cannot mimic the healthy form of the cells in that area. So it has to be given together with a normal tissue so that the stem cells would replicate the normal tissue. Okay? So I hope you understood what I meant. All right? So another situation where stem cells would be good would be for patients who have CKD. But this is theoretical, no? I mean, this is not confirmed. But for CKD patients, since your kidneys have been destroyed already, then since stem cells can mimic, no, or can mimic or become the cells or the tissues where they are administered. So stem cells can become your kidney cells. That would be the new filtration system. Okay? Although this is not confirmed, right? Another one is the retina. Okay, your eyes. So for patients who have been, the retina was destroyed already, you can actually administer stem cells on the retina to generate a new one. Okay? So basically, that's the function of stem cells. It's to make new cells, essentially. All right? Now, for cancer, I would be careful in administering stem cells to cancer patients because since stem cells can become whatever, no, they can become whatever they attach to. If the stem cells attach to a cancer cell, then the stem cell would also become a cancer cell. Okay, so be careful, right? Be careful. Yeah.
I really wonder how did it come about that stem cells became like a potential supplement or kind of protocol for the cancer patient to take? Because it really doesn't make sense to me right up front, right? Stem cells are cells that can become any cell. What you want to do in a cancer cell is to kill the cancer cells, whereas stem cells don't promote the killing of any cells. The only way I can think of stem cells being useful in cancer treatment is really if it can be straight away formed into immune cells. But that can actually be done simply with taking Simply Nature PPAR extracts that help cell delineation. So help and this is why if you have low red blood count, white blood count, when you take Simply Nature PPAR extracts, your red blood cell count goes up, your white blood cell count goes up. So this is true for dengue fever patients. It's also true for patients who are undergoing chemotherapy and their red blood cell count drops. So this is a direct impact of creating more immune cells in your body, red blood cell, white blood cells. So yeah, Doc, have you any idea why? How did people get some idea that stem cells could be used for cancer treatment?
I actually have no idea why
Right, because
this
it
came
doesn't
up in the
seem
first place.
to, yeah, it doesn't seem to match up. But for the viewer who asked this question, it's a very good question. The most common area where I hear about this is really in direct marketing programs. Maybe stem cell sounds very scientific, very advanced, then anything advanced might be good for cancer. But however, really no. Stem cells, in fact, is the place where stem cells are used the most, and it's easy to understand, it's actually in anti-aging, right? People who want to look young and feel young, so they actually inject these omni cells, right? The cells that can become anything, help you rejuvenate your body. But for cancer, my personal opinion is do more research about that and in-depth research, right? To find a scientific background. But I think logic-wise, Dr. Jansen gave a really good explanation, right, about what stem cells are, and it will make more sense to go and strengthen your immune system directly and use other forms of protocols that actually attack the cancer tumor rather than just stem cells as a general protocol or even supplement. Yeah.
Okay, so that question would be wonderful, right? So to keep yourself updated with our latest online events and promos, please don't forget to like our Facebook page and subscribe to our YouTube channel to replay and share with your family and friends or loved ones these informational weekly webinars and very inspirational success stories. Sadly, this next question would be our last question, Doc. Okay. I guess we're almost done with our question and answer portion. But let me ask this first, okay? From Gloria Armado, what can you say about the low carb diet?
Okay, low
No,
carb.
she didn't
Yeah,
say keto. She said low carb. So that's
low carb.
different.
Yes,
That's different.
yes. A ketogenic diet is actually also low carb. Now, with low carb diet, with what I see, uh, in the internet, no, it means a lot of things. But in the medical sense, no, a low carb diet is a diet that is very low in carbohydrate. So for macronutrients, no, you have carbohydrates, protein, and fats. So if you have a low carb diet, then the amount of protein and fats would comprise a high would consist of a higher percentage with when it comes to the overall diet. Okay. Now let me define first, no, what carbohydrates are. So there are two types of carbohydrates. You have complex carbohydrates, you have simple carbohydrates. Complex carbohydrates consist of the natural plant foods that we see in nature. So the fruits, the vegetables that you see in the market, or basically food that's grown, no? Whole foods, whole plant foods that are unrefined, unprocessed. Okay, those are complex carbohydrates. Now you have simple carbohydrates, which are the sugars. Your cakes, your pastries, sweetened beverages, those are essentially simple carbohydrates or refined grains. Um, yeah, those foods, no. So when we talk about low carb diet, then they would comprise a lower amount with the overall diet. So now you will be consuming more protein, more fats. And protein usually consists of animal food products like your eggs, your red meat, white meat, dairy products. And for the fats, that would be your avocado, your nuts, your oils. Okay, a low carb diet. Now, we have to we have to discuss low carb diet in the proper context. So what is it being used for? Because if it is being used for seizures, epilepsy, then it would reduce the frequency of the episodes. I actually have one patient of mine who has epilepsy, and the neurologist, her neurologist, prescribed a ketogenic diet. So the patient came to me. I prescribed the patient what foods she should be eating, because not all foods, non she cannot eat. It's not as straightforward as it may seem. No, that's what I mean. So I made a nutrition prescription. In turn, she went to the dietitian for the dietitian to create a meal plan for her. Okay, so that's one. If a low carb diet can also be used to lose weight fast. Okay, it can make you lose weight quite fast, actually, if you're on a ketogenic diet or a low carb diet. However, the weight that you would be losing would be your skeletal muscle mass, your muscle mass, and water mass. You won't really be able to replace the fats inside your body because you're essentially losing fat and eating fat. Okay, so doesn't work that way. Now, when it comes to the more important predictors of life expectancy, so that would be your cardiovascular disease, your metabolic diseases, cancer, okay? Then a low carb diet will not be able to reduce your risk of developing these diseases. Again, a low carb diet will not be able to reduce your risk of developing heart disease, hypertension, cancer, diabetes, fatty liver disease. Okay? Likewise, it will not be able to reduce your risk of death or premature death. Okay, I hope I made this clear.
Yes, thanks, Doc.
You
Sorry,
know,
mhm.
No, I just want to add to that. Doc's absolutely right about this because many people have illusion or a misunderstanding of the effects of keto diet, especially diabetics. Diabetics actually go on low carb diets or no carb diets, like the ketogenic diet, and they will say that their blood sugar has improved. Very simple. The reason why your blood sugar has improved is because you're taking no sugars in your food. So if you have no sugars in your food, your blood sugar level will drop, right? But your body actually needs carbohydrates to function. Your brain needs carbohydrates to function. So on the flip side, I think, Doc, for the average Filipino, trying to get on a low carb diet will probably help them a lot because the average Filipino takes a very high carb diet, and all the wrong carbohydrates: white rice, potato chips, chocolates, snacks, biscuits. All these are high carb diets. Lots of French fries. French fry is not a vegetable, right? So I think in general, if you are a normal person eating normal diet, it's very likely your diet is unhealthy. So cutting carbs for the average person is probably a healthy move, right? You're probably eating 2 bowls of rice every meal. Cutting it to 1 bowl or half a cup of rice every day, every meal is a good move. All right. Eat more vegetables. And whatever you cut in carbohydrates, you make up with vegetables, not meat and fat. All right. And I think that would actually be a positive change. What do you think, Doc? It'd be a positive change for most Filipinos if they attempt to go on a lower carbohydrate diet. Not that they are low carb, but lower carbohydrate diet.
Well, yes, definitely. If you go on a lower carbohydrate diet, that would be better. But my take here is don't go on a low carb diet or a lower carb diet. Okay, go on a high fiber diet.
That's
Okay,
right.
that is the more important thing to do, because if you go on a low carb diet, that means you might also be missing out on the healthy foods, no, on healthy plant foods, which are your complex carbohydrates.
Like
Okay.
sweet potato.
Yes, yes. Sweet potatoes are actually very healthy, and sweet potato is also included in my list of foods that is quite good for cancer.
Okay. Last but not least, I just wanted to answer this one. Someone asked a question, a misconception. She's taking metformin for 2 years, twice a day, but blood sugar got high only Tuesday morning because she ate a lot of sweet bokoyo. I don't know what's bokoyo. And one Mountain Dew. Okay, so don't drink Mountain Dew, right? That's number one. Let it be your one-time break, okay? But usually it's 5.3, 5.1. Is it necessary to take 2 tablets a day, AM and PM? So she's asking, should she increase the dosage of metformin, Dr. Jansen?
Go for a consult first. Don't
Yes.
just take or
Yes.
increase or modify the medications that you're taking. Okay, because you might get dizzy, suffer from dizziness, lightheadedness, okay, because of too much medication. That's dangerous. Okay, so for all our viewers, all right, don't just modify the medications that you're taking by yourself. Okay, always do it with the guidance of a doctor. Right? Because especially for diabetics, no, having a high blood sugar is safer compared to a very low sugar level. Okay? Again, I repeat, having high blood sugar or uncontrolled diabetes is better versus having very low blood sugar or hypoglycemia. Because for hypoglycemia, or if your blood sugar is very low already, you can lose consciousness, you can suffer from dizziness, and if you suffer from dizziness, you can fall off, you can suffer from accidents. Okay? So, don't just modify your medication. Always go to your doctor. It may be me or it may be your attending physician before you change your medication. Okay?
And last word, you can actually reverse diabetes with PEPA tablets, right? So you don't need soft gel or anything like that unless your diabetes is very serious. So if you're a normal case of diabetes, within 1 to 3 months, you can actually normalize your blood sugar and you can be off your maintenance meds. I would suggest that you do it under the watchful advice of Dr. Jansen. So make a consult with him. But if you really if you want to start, you can always get a bottle of Simply Nature PEPA tablets, minimum 10 micro tablets 3 times a day, and that you should see your blood sugar improve within a month and probably normalize in less than 3 months. And however, you have to maintain on this for more than 6 months, and the effect will be more or less permanent. You will actually be reversing your diabetes condition, all right, your blood sugar management issues. So again, I suggest for the viewer who asked this question, instead of worrying about whether you should increase your metformin or not, why not let's solve the diabetes once and for all, right? Go for a consult with Dr. Jansen and be able to reverse your condition totally. Right, Doc? You've been very successful with, and you probably help that person lower their blood cholesterol at the same time.
Yes, just like the patient that I presented a while ago. Although he was still diabetic, no, but the blood sugar control improved already. But the more important thing there is the reduction in his cholesterol level was so huge from 167, which is actually a pretty darn good cholesterol level already. It went even further below to 119.
Wow.
That's quite low. So at this point, I am actually already considering stopping the medication. However, I don't want to just completely take him off the medication because he has peripheral artery disease. So I want it gradual.
Gradual. All right, Doc, there is Miss Sally making a plea with many, please. So let's answer her question. She says, Doc, my mammogram says I have Barrett's 4 suspicious abnormalities in the ill-defined hypoechoic nodule. She does not want to go under biopsy. Is it okay to have a test CA153 instead? What's the difference? Then then she said, my cancer 153 result is 19.79. CEA result is 1.55. Yeah.
Yeah, the tumor markers doesn't mean anything. It's inaccurate. So
Okay.
some breast cancer patients who have full-blown breast cancer, diagnosed with breast cancer, sometimes they have normal CA 19-9 levels. Okay, so doesn't really mean anything. All right.
Okay.
So
So
my
what's the
advice to
advice for
you
this
is
patient?
you have to undergo biopsy. Okay, you have to undergo biopsy to confirm if that is indeed cancer. However, depending on the size, no, you can actually skip biopsy. You can have it removed totally already, depending on the size. So you have to see a surgical oncologist for this, no. And my recommendation would still be Dr. Jamie Katapia because he is really a very good doctor and very easy to talk to as well. Okay.
Doc,
So that's my advice. Yeah.
I'm gonna play the devil's advocate. I'm gonna guess what's inside this patient's mind and ask this question. Doc, can I consult you, try your natural protocols, and see if 1 month later my 4 suspicious abnormalities have shrunk before I go for biopsy?
We can try, but I have to explain to you the risks of doing so before we undergo or before we go on that path.
So
So
yeah.
please go. Yeah, please
So
go
it's
for a
possible,
consult.
all right? So for Sally, I think I asked that question that is on your mind. Is there anything you can try first? Because you understand what Dr. Jansen is saying. If the biopsy is necessary, then you want to do the biopsy. But I'm sure you're thinking in your mind, can I try something natural first? And if the things shrink, then maybe I don't have to go for the biopsy. All right. So if that's on your mind, just arrange for a consult with Dr. Johnson. And after he explains the risk to you, if he looks at your condition, if if you're strong and everything's doing well, he might work with you on that attempt. All right, but at least very good is that on the back of your mind, you know what we said about going natural, right? You still have to draw a red line. Okay, you have to know when. Okay, I've tried natural, whether it's working or not working. Okay, it's not working. Let's not wait any longer. What must I do next so that I don't put myself at the risk of my cancer getting out of control? Okay, so to all our viewers, I think that's my last word tonight. Tonight is a very good program. I think many viewers are very happy because Dr. Johnson discussed a successful case of managing a cancer patient without chemotherapy, without radiation therapy, totally natural. So there you go on our program, right? You found an actual case where Dr. Johnson and I were sharing about this. On top of that, I just want to remind you, we do this, but we do this responsibly. We still have red lines defined. So if the condition ever crosses any of these red lines, we know what to do next in terms of normal, be it surgery, chemotherapy, immunotherapy, or radiation therapy. But of course, it will always be supported with very effective, strong natural therapies. Not that we give that up, we then integrate both natural and the conventional together. But there you have it. So, Dr. Johnson, tonight you have the last word.
That's right. Yes, Doc.
Yeah. So for the patients out there, no, who are watching, say for example, you're already in a situation wherein you already underwent chemotherapy, radiation therapy, and still the cancer is there, and it seems that your oncles have given up on you. Um, Please keep in mind that there's always hope. There's always something that we can do. Okay, especially for you. It may not actually kill off the cancer, but at least we can improve your quality of life. Okay, so there you have it. Thank you for listening, everyone. And April, you have the floor.
Okay, thank you, Sir Shan and Doc Jansen. Actually, they are so generous with the time. But for those of you, again, who wants to have a consult to Doc Jansen Kalalan, the link is for the schedule of appointment is in the description box, or just type in on how to consult in the comment section below. Okay, by the way, Doc and Sir Shan, we will having our next webinar next week, November 16, Thursday, same time, 7:30 p.m. November is a lung cancer awareness month. That's why our topic is entitled lung cancer new patient uptake. And also, I know we are all here to invest in our health. That's why there's no more excuse for as low as 650. You can start your health journey with us via our official Shopee and Lazada Mall. Available our Kickstart or Power Pack for detoxification and immune system boosting through complete nutrition. The management has approved a buy 10, get 1 free as an advanced holiday season. So what are you waiting for? Don't wait for the holiday rush to get the best gift of health. On November 11, 2023 at 5 o'clock p.m., we will have our Lazada Live, and we'll also simulcast here on Facebook page. Once again, thank you for watching the Simply Nature webinar powered by SMG or Simply Healed Medical Group, because your curiosity about your health and your victory over cancer and metabolic diseases is what keeps us going. Because here in Simply Nature, we are always with you from start to healing. Thank you, everyone. Good night and God bless you all.